Republicans in the U.S. House have unveiled their plan now to cut Medicaid spending by hundreds of billions of dollars over the next 10 years. The plan is part of the GOP's strategy to drastically reduce federal spending and pay for trillions in tax cuts. When it comes to Medicaid, the plan calls for work requirements for all able-bodied recipients, increased eligibility checks and income verifications, and a 10% cut to states that allow undocumented people to sign up for Medicaid.
The Congressional Budget Office estimates these cuts will knock $700 billion off the deficit over the next decade. It would also take health care from over 8 million people. News 8 political reporter Mike Cerulli has been getting reaction from leaders and explains how this could impact Connecticut.
The House Republicans' Medicaid proposal was met with polarized responses in the Connecticut legislature.
It confirms our worst fears.
I don't think anything that we see in this bill right now is too outlandish.
Republicans like the provisions that go after states like Connecticut that provide health care to those in the country illegally. They also like the plan's proposed work requirements.
They're really targeting what we call here Husky D, which is working people who are working, people who have the ability to work and who still get Medicaid.
Democrats are alarmed by the prospect of anyone being kicked off Medicaid, and they argue that work requirements are ineffective and cumbersome.
It'll cost Connecticut taxpayers a ton of money to set up this program, and it just hasn't worked anywhere it's been tried.
The two parties also clashed over the proposed expansion of eligibility checks, which Democrats say is just a roundabout way to kick more people off their coverage.
What it's going to mean is that the folks who brought you the Department of Government Efficiency are going to be just saddling people with paperwork.
I think if the state of Connecticut workers are doing their job and they're helping people make sure that they have their eligibility in, they're not going to see a lot of people kicked off.
The association that represents Connecticut's hospitals weighed in on the bill, and they didn't mince words.
This is a bad bill for Connecticut hospitals and for our patients.
The Hospital Association says if the federal government lowers its commitments to Medicaid, someone will end up footing the bill.
When the state can't bring in those federal dollars to support Medicaid, hospitals and other providers have to go try to find those resources from other places.
The GOP Medicaid plan now must pass muster in both chambers of Congress before it can get to the president's desk. Zach Kessel covers D.C. politics for the Washington Free Beacon. He says final votes could be taken as far out as July after Congress returns from its holiday recess.
If we don't have anything on the president's desk, I would imagine after that recess, Congress is going to be working overtime to have this done by the first week of August.
That timeline would mean Connecticut legislators would be in the dark as they try to wrap up work on the state budget in early June.
They just won't know what they'll be on the hook for in terms of Medicaid funding.
Reporting at the state capitol, Mike Cerulli, News 8.